Do you have pain in the sides of your nails which started with redness? It swelled up and there was a pus discharge. Later, you could see some sort of reddish growth on either sides of the nails. It could be ingrown nails. Hello all, I'm Dr. Harish Prasad. I'm a dermatologist and a dermatosurgeon practicing at Vitalsklinic Clinic, BTM Layout and Electronic City, Bangalore.
Now let us see what are the risk factors in development of ingrown toenails.
Excessive sweating and maceration can cause the skin of nail folds to become soft that can be easily penetrated by the nail, causing the symptoms of ingrown toenails.
Trauma could be one of the causes for ingrown toenails. Trauma can happen during sports like football, or trauma can happen when you hit to the corner of the table.
If your shoes are too narrow or they are too tight, the extra pressure placed on your toes can lead to the edge of the toenail growing into your skin, causing the symptoms of ingrown toenails.
Learn to trim your toenails properly. Cutting your toenails which are improper and rounded, improper and V-shaped, improper and too short can be risk factor for ingrown toenails. The nail plate can become infected by a fungi or a bacteria, making them brittle, resulting in easy breaking of nail spicules, making it easier for the nail to pierce the surrounding skin, causing ingrown nail.
Genetics too plays an important role in development of ingrown toenail. Like if you have improper shape of nail plates, if you have thick nail folds, or there could be a medial rotation of the finger, or sometimes reduced nail thickness. All these factors plays a role in development of ingrown toenail. There are certain rare causes for ingrown toenail development. They could be congenital because of trauma during birth. Diabetic patients are prone for ingrown toenail infections. Certain medications like retinoids or cyclosporine can cause ingrown toenails, and rarely malignancies. There are various methods to treat ingrown toenails. Mild to moderate lesions with minimal to moderate pain can be treated with conservative therapies. Moderate to severe lesions with severe disabling pain, erythema and pus discharge usually requires surgical interventions. Ingrown toenails requires proper assessment, staging, evaluation of the predisposing factors and surgical corrections if required. At Vitals, we have expert dermatosurgeon who has performed hundreds of such surgeries with least recurrence rates and hundreds of happy patients.
If you are suffering from ingrown toenail and looking for treatment options for satisfactory results with least recurrence rates, contact Vitals Clinic at 920-6869-610 or write to us at vitalsklinic@gmail.com.